Hello everyone, my name is Christopher Gallucci and I would like to welcome you to my internship presentation. During these times of unprecedented technological growth, we are all increasingly connected through technology. Higher educational attainment is perceived as a means to improve standards of living, and therefore distance learning has gained popularity and become one of the fastest growing methods to obtain a degree. For the Global Health Internship, I chose a graduate teaching assistantship here at Southeastern University within the DHS 8810 course titled Epidemiology in Global Health. The reason I chose an epidemiology course is because epidemiology is vital for the field of public health. I chose an assistantship to learn teaching skills so that I could become more familiar with navigating online teaching platforms to enhance my personal knowledge as well as provide me with experience if I do plan on teaching within the future. Another reason why I chose to intern for Dr. Clark's Epi class is that from what I remember as a student, it was one of the most challenging courses in the program, so I figured that there would be no shortage of work. I included three main headings within my literature review: history of distance learning, implementation and management, and advantages and disadvantages. One of the first instances of distance learning began in 1892 when Pennsylvania State University utilized the United States Postal Service to deliver correspondence courses to rural farmers who were unable to attend campus in person. By the 1990s, exponential growth in computing and internet technology led the University of California, Berkeley to be able to offer one of the first online distance learning programs. Fast forward to pre-COVID-19, and the number of students enrolled in online distance learning programs in the United States has increased to more than 6 million students. During COVID-19 and the requirement of social distancing guidelines, a majority of institutions have now mandated either a fully online or blended learning program. It may be argued that modern educators must maintain a certain level of technical proficiency, as most employers now require the use of computer, email, and web pages to support communication and instructional efforts. The combination of a technologically adept instructor with effectively designed multimedia content is important for the delivery, application, support, and success of distance learning. This is especially true during the COVID-19 pandemic, when educational platforms and stable internet connections have become vital as teachers and students have had to rely on these technologies to prevent discontinuity in learning because of the temporary closure of the majority of educational institutions. Furthermore, in order to deliver a successful online course, there are important other considerations. For example, online instructors should not simply view their courses as repositories for content with strict self-paced student learning. Instead, regular interaction and open communication should be encouraged and mediated by the instructor to foster open collaboration and transparency. Lectures, curricula, and multimedia content should be continually researched and designed according to evidence-based practices to maximize learner outcomes and student satisfaction. Among the most cited advantages of distance learning include the high level of accessibility and convenience because of the availability of educational materials, tools, and supplemental information to instructors and students with very little restriction. Logistical barriers to pursuing an education, such as distance and time, are eliminated through online platforms, therefore allowing students to pursue a degree with greater flexibility. Among the disadvantages of distance learning is that there might not be adequate opportunity for hands-on clinical experience, which may limit professional development, especially for those in the clinical-based medical field. There are also those students who report that they feel unmotivated to learn in distance learning programs, citing a lack of instructor support and adequate social connections that are more commonplace in the traditional classroom setting. My mentor for the internship was Dr. Jody Clark. Dr. Clark is an internal medicine physician, epidemiologist, and teaches several classes here at Southeastern University, including the Global Epidemiology course, as well as a Community Health Promotion and Disease Prevention course. Dr. Clark finds joy in helping others learn about epidemiology and global health, and believes that having a thorough knowledge of global epidemiology and being able to apply it to public health issues is one of the most important public health skills that an individual can have as a health science professional. There were 18 students in the Global Epidemiology course. Out of the 18 students, there were 11 females and 7 males. Nobody in the class was younger than 30 years old, and all the students had no less than 5 years of working experience in their respective professions. Among the two most common professions in the class were public health professional or clinician. Every student had at least a master's degree, and half of the students had additional certifications pertinent to their particular career path. Florida and Georgia were identified as the home state for 1/3 of the students, whereas the rest of the class were dispersed across the eastern seaboard of the United States. Due to the nature of virtual education, the global epidemiology course internship occurred remotely. Meetings with the mentor and students were conducted via telephone, email, discussion boards, and conferencing software. I am pleased to announce that all of my learning objectives were met during the internship experience. Having the opportunity to engage and support students during the course was rewarding and taught me a lot about the instructor-student dynamic. More specifically, that there are significant differences between a traditional classroom setting versus the virtual classroom. A large proportion of how we communicate is nonverbal. Engaging and showing support for students is a lot easier to do in person than it is virtually through email or discussion boards. In that sense, there is an art to providing feedback and engaging students in online courses. For example, it is important to be careful in how one provides constructive feedback as to not appear condescending. But you should also try to emphasize when you are providing important advice or being firm so that the student doesn't simply dismiss or miss the information you're trying to provide. It is also important to regularly follow up and show support through constant electronic communications to avoid appearing unengaged or absent. An instructor may be working hard to complete tasks such as grading papers, however, students don't often see that. Infrequent communication and not providing public status updates makes it seem as though the instructor doesn't care or is not involved, which may lead to feelings of student isolation. Creating a balance when having student discussions is also important because if you take too long to respond, you might inadvertently be causing more stress for a student. However, if you respond too quickly, students will begin to expect immediate responses, which might begin to become distracting and burdensome for the instructor. Being able to utilize Canvas as an instructor was important because it allowed me to practice creating course content using a virtual software platform. It also allowed me to uncover some of the strengths and weaknesses of Canvas and how that applies to course administration. Specifically, I noticed how easy it was to overlook some minor settings, which would greatly affect how the course pages are displayed from the student end. This might explain why some courses within the program are well constructed and easy to navigate, while others contain redundancies as well as links that were often hidden and unable to be located. Lastly, I learned how much of a problem plagiarism is among students. Although I'm sure most of it was unintentional because I found that a lot of students didn't have enough writing experience, improper citations or completely missing citations was common enough that it warranted recommendation for writing center help for a majority of the students. As we move forward in uncertain times during the pandemic, one thing is clear. Virtual education will only continue to grow in popularity and administration. Thanks to Dr. Clark and the internship experience, I now feel more confident in my ability to administer an online course and will continue pursuing a profession in academia. Based upon my research, experience, and current events, if I had to make recommendations, they would be as follows. It is important to utilize best practice models. The format of online courses should be based upon the most current best practice models to stay relevant. For example, the format for media content and video production quality. Instructors should be cognizant of how the communications are perceived by the students and should receive training if necessary. Lastly, we need to reduce feelings of isolation. We need to make a digital world feel more personable. Feelings of student isolation should be reduced as much as possible through a number of methods, such as more opportunities for synchronous learning or live interactions, regular outreach by academic advisors, or something as simple as the instructor sending out regular announcements to students that highlight the good work being done by a particular student or group of students, or maybe something as simple as a reminder to seek help when needed. Whatever can be done to make online learning feel more personal would go a long way in improving student morale and showing good faith regarding support.